Tracing the impact of U.S. opioid policies, history, ethics, and equity in focus. I have my overview, which will be talking about history, the deep dive, social justice lens, ethics and social justice, and advocacy. Here I have a timeline, and it is the history of opioid policy. The timeline of major U.S. opioid policies, one being Controlled Substances Act in 1970, which created a drug schedule and classified opioids as Schedule II, Foundation for Modern Drug Enforcement. 2000 was Drug Addiction Treatment Act, which allowed physicians to prescribe buprenorphine and opioid addiction treatment. In 2018, you had your Support Act, which addressed overprescribing, expanding treatment access, improved data collection. Here we go into our deep dive into 3 key opioid policies. Your first one in the 1970, your Controlled Substance Act, was your health and social need, was the rising drug use, desire for standardized drug scheduling, your public attitudes, war on drugs, criminalization of addiction. The unintended consequences was harsh sentencing for opioid users, disproportionate affected communities of color. Was there propaganda? Yes. Nixon's war on drugs used imagery and rhetoric and the rationalized. In your current status, it is still active, although parts have evolved, such as marijuana reclassification efforts. Your Drug Addiction Treatment Act, DATA 2000. The health social need recognized addiction as a treatable medical condition. The public attitudes. It was mixed, still is, the fear of enabling addiction, but it is growing advocacy for treatment. The unintended consequences. There are barriers prescribing, and there's limited access in especially rural areas. Was there propaganda? Yes. The stigma around medication-assisted treatment is persistent. Your current status, the X waiver requirement repealed in 2023. And then your Support Act of 2018, the health social need, opioid overdose epidemic at its peak, public attitudes, high public concern due to overdose deaths, and your unintended consequences focused more on prescription opioids than illicit drugs. And the propaganda, yeah, kind of there. Some cases not fully addressed to the root concerns. In the current status, it is active with ongoing updates and grants. Into your social justice lens, the populations most affected, your low income, rural communities, veterans, communities of color, and it's overpolicing of Black and brown communities, especially those that are opioid users and have disorders. Under treatment in marginalized areas due to provider shortages and stigma. And the help versus wanted. The ones that are more likely to get help are your white communities that are framed to have the public health issue. And the ones that are harmed are your communities of color, your Blacks and your Latinos, because they are framed as a criminal justice issue, and that is historically identified. Your fair distribution of resources. No. There are areas that have received more funding and quicker access to things, such as naloxone or your MAT. In the treatment, it all depends. A lot of the low income and does not tend to get that assistance that is needed. And your continuing impacts. Your disproportionate incarceration for opioid is high. The possession that is there is high. Treatment access is still inequitable. The MAT providers are rare, extremely rare, especially in your poorer regions. And your harm reduction, like for example, like your needle exchanges, safe use sites, they're contested. In my area, I don't have any of those that are local, and a lot of those things aren't known about by a lot of people because they're not used in your social area for providing care. For your ethics and social justice, ethical considerations, criminalizing addiction violates your person-centered care. Inconsistent treatment access creates your ethical dilemmas for care equity. The stigma that is around and against MAT still impacts your policy and service delivery to this day. The policy improvements that are needed: decriminalization of personal use, universal access to MAT and harm reduction, and stronger anti-discrimination protections in treatment settings. I also believe needs to be identified for your younger adults and teenagers. Impact on families and your workforce, lost productivity and family instability, the trauma in families that are affected by individuals that are incarcerated or overdose. Your NASW Code of Ethics connections that pulls us all together is your social justice. Advocate for equal access to treatment, reduce mass incarceration, and then the dignity and worth of the person. Respect individuals with opioid use disorder. Support recovery, not punishment. And I love this because that is one of the biggest things that pulls on my heartstrings. And then into advocacy recommendations. The policy advocacy: push for full decriminalization of opioid use. Advocate for permanent expansion of harm reduction services. Demand equitable distribution of treatment resources through legislation. Reach out to your legislator. Action steps: educate policymakers using client stories. I love being personable and talking about my clients, especially those that do have opioid use disorder. Your action steps: educate policymakers. Do it, do it, do it. Join or form coalitions with harm reduction organizations. Create and promote that public awareness using campaigns, social media, anything that can help reduce stigma. Community education and service needs. Community training. I got trained in college to administer Narcan, and that has been a lifesaver for me working with the young population with opioid use disorder. Education on MAT and harm reduction. Educate yourself, educate others, but mainly educate yourself first so you know as a social worker. Expand culturally responsive treatment programs. Look into the different programs and what is offered in your area, in your surrounding areas, so you can better assist and aid your clients and others moving forward. And then this is my references used. Thank you.